Hello, everyone. We are waiting a few minutes before the webinar starts. We have 150 attendees so far. Bear with us. Hello, what about starting? Yes? Okay. Good afternoon, everyone. I'm going to give you a few instructions before the webinar starts officially. This webinar is co-organized with the Office of the High Commissioner for Human Rights and APT, and we have interpretation. So please, participants, click on the little globe below your screen. If you want to hear it in English, you press off. In French, you click on the French, and Spanish on the Spanish. Most of the interventions will be in English, but one panelist in Spanish, so you will have to change the channel. There is a live tweet from this webinar happening on Twitter at APT_Geneva. And we're also trying to do a live Facebooking on OHCHR website or Facebook. I can see some of you are raising your hand. Due to the number of distinguished speakers and panelists, it will be very difficult for us to accept interventions orally. So we have the Q&A available on the webinar. So please write down your questions and answers, and we will be able just to take them. The webinar will work the following way. We will have interventions from Mr. Salama as welcoming remarks. Barbara Bernat, our Secretary General, will moderate the whole session. And we will have two thematic discussions where 4 speakers will give their specific insights on issues related to this webinar on the occasion of the International Day in support of victims of torture. So we'll have 4 speakers giving 5 minutes intervention each, followed by a Q&A sessions. We will take your questions and answers from Twitter, from this webinar, and we'll give them back to the panelists of that session, who will, each of them, have 3 minutes to respond. I think this is it. We have 216 participants. More of you may actually come. I would eventually like to give the floor first to Mr. Salama, if you would like to give your welcoming remarks.
Thank you, Audrey. Distinguished members, ladies and gentlemen, it's a pleasure for me to welcome you to this webinar organized by the Office of the High Commissioner for Human Rights and the Association for the Prevention for Torture in the occasion of the United Nations International Day in support of victims of torture. COVID-19 pandemic created unprecedented challenges to the struggle against torture and ill treatment, including the adoption of emergency measures and associated derogations from treaty obligations, which have increased the vulnerability of persons deprived of their liberty and of those who survived of the scourge of torture. After issuing a joint statement on the issue, the 4 United Nations anti-torture mechanisms, the UN Committee Against Torture, the UN Subcommittee on Prevention of Torture, the UN Special Rapporteur Against Torture, and the UN Voluntary Funds for Victims of Torture, will for the first time be exchanging live together on this issue in these particular circumstances. This event shows that while COVID-19 has made the work of human rights mechanisms difficult, through innovative working methods, human rights mechanisms can continue to pursue their mandates and play their crucial role in advancing critical human rights issues that are even more relevant and urgent than ever. We are privileged to be joined by representatives of civil society organizations from Brazil, Jordan, the Philippines, and South Africa, who will share testimonies about delivering assistance and rehabilitation services to torture victims and their families on the ground. Without further ado, I would like to give the floor to Ms. Barbara Renath, Secretary General of the Association for the Prevention of Torture. I wish you successful deliberations. Over to you, Barbara.
Thank you very much, Mr. Salama. And good morning, good afternoon, good evening to all of you. In the name of the Association for the Prevention of Torture, it's a pleasure and a great honor as well to co-host with the Office of the High Commissioner for Human Rights this webinar on the occasion of the International Day in support of victims of torture. I would like to welcome you all. We have more than 250 participants, representatives from states, Office of the High Commissioner, national human rights institutions and PMs, and civil society organizations, international and national. The discussion will be on, the webinar is on combating torture and ill treatment in the COVID-19 context, testimonies from the ground. And as already mentioned, we have the pleasure of having the 4 distinguished mandate holders from the United Nations, as well as testimonies from NGOs from different regions of the world. For some months now, we are all facing a global pandemic that is affecting us and affecting us all in the different regions and in our different countries. And states have taken measures to prevent the spread of the COVID-19 virus that are impacting on our daily life through quarantines, lockdowns, curfews, and other restrictive measures. But these measures are affecting disproportionately persons deprived of liberty. We are not only facing difficulties in applying the protective measures, of course, but also have faced higher risks of being infected or die. COVID-19 is also affecting disproportionately persons in situation of vulnerability because of their age, race, color, national or ethnic origins, gender, sexual orientation or expression, their migration status or their economic status, or also victims of torture. In their joint statement today, the 4 UN anti-torture mandate holders warned that the pandemic is leading to an escalation of torture and ill treatment worldwide. So the discussion today is therefore very important, and it will be divided into 2 sessions. The first session will look at the risks impacted by the restrictive measures in the time of COVID, and the second session will look at the specific risks faced by persons deprived of liberty. As I already mentioned, we have 8 distinguished speakers, and we would like to have some times during each session to have an exchange through the Q&A. So we will have to be strict with time. I would not like to cut the people, but I just remind you that we have to respect the time frame. Let's start with the first session. And I would like to welcome the 4 speakers. So Mrs. Claire Ballard from South Africa, Mr. Nils Melzer, the Special Rapporteur on Torture, Professor Nimia Simbulan from the Philippines, and Mrs. Vivian Matheson, the Chair of the UN Voluntary Fund for Victims of Torture. No, I mentioned all. So each will have 5 minutes, and we'll start with a general question, but each speaker will speak from their own perspective. So based on your experience, what are the risks associated with restrictive measures in times of COVID? And I will start with Mrs. Claire Ballard, who is from the organization Lawyers for Human Rights in South Africa, who will share from her perspective their observations regarding the excessive use of force by law enforcement agency and the impact of the judicial system paralysis on the rights of victims to redress. Mrs. Claire Ballard, you have the floor.
Thank you very much, Chair. And thank you for this opportunity. I'd like to greet everybody that is participating. My name is Claire Ballard. I work for Lawyers for Human Rights. It's a large NGO in South Africa. I am based in Cape Town. I run a program called the Penal Reform Program. My business is prisoners' rights litigation, but because I deal primarily with use of force and abuse of power and the various risks associated with that, my work extends to contexts outside of prisons frequently, all the more so during this lockdown period in our country. We have, as an organization, had to shift our working structure quite extensively during the lockdown period, which commenced officially in March. It is a phased lockdown. We began with the strictest phase, which was all people had to be at home at all hours of the day, to a phased release program, essentially. We are now on level 3, which is a sort of moderate form of lockdown, but still rather strictly enforced. It is no secret that we were governed by a system of apartheid for many decades, until just over 20 years ago. I say this because the spatial and geographical effects that were brought into effect during apartheid remain today. That what we call spatial apartheid. We have a predominantly wealthy white middle and upper class living in excellent socioeconomic circumstances, and you have the largely poor, black, marginalized groupings of a society living in predominantly overcrowded and largely unhygienic conditions in what we call informal settlements. These are very crowded on account of urbanization. And I deem this important to mention because we see the saturation of policing in those areas, particularly during a lockdown phase. And so, as is the case in all places around the world, we see those who bear the brunt of the use of force and exploitative measures meted out by police and enforcement agencies. The victims of those are largely poor, marginalized people who simply don't have access to lawyers, to methods of redress, etc. We initially began as an organization, created a hotline open to the whole country to field any complaint. We have fielded well over 2,000 calls. The majority of which dealt with use of force, abuse of power. Of course, we had many complaints from our asylum seekers and immigrant population, as well as forced evictions, etc. With the lockdown came a new policing regime. It was different because it involved different enforcement agencies from the norm. It also, the lockdown regulations created new offenses, some of them quite minor, that dealt with predominantly issues around curfew, being out when you shouldn't be out. Again, things very reminiscent of the apartheid days and order. through that hotline, we have received, as I said, many reports on use of force. We have taken those reports and we deal with them as best we can. This frequently involves litigation, but often it involves simply bridging the gap between the person and the correct complaints mechanism. Ordinarily, the complaints mechanism is quite clear. There is a complaint of excessive use of force or torture against the police, and you go to the correct complaints or oversight body. That scenario is different now because they're different law enforcement agencies. We have the military, we have the police, we have private security officials being employed to police certain areas. And so that complaint scenario is very different from what it ordinarily looks like, and for your everyday citizen, that's very difficult to navigate. So we are helping people do that. We have seen deeply disturbing, upsetting accounts of policing, torture leading to death. In fact, before we had a number of COVID deaths, we'd had, in the first weekend of lockdown, we'd had 3 or 4 deaths at the hands of police. So I think that paints a picture in itself of how things escalate so quickly during a lockdown repressive phase in our rule of law society. We take those complaints seriously. We litigate them where we can. There is no automatic system of redress as the convention envisages. We have domestic legislation that establishes torture as an offense. But in terms of monetary redress that actually addresses the injuries sustained or the loss of life, that involves large-scale civil damages litigation. We undertake that, but it comes at an enormous cost. It costs millions. It costs millions that we don't have, that donors don't have. But we do it because in those circumstances, that is what justice requires. And it is the only form of redress available to the victims. And so we proceed on that basis. I'm going to end there. I think that's my 5 minutes. I look forward to questions.
Thank you very much, Claire, also for respecting the time. And thank you very much for these testimonies and for the work you are doing to help the victims of torture, and including death by the police and not just by the COVID. I now give the floor to Mr. Niels Meltzer, the Special Rapporteur on Torture and Other Cruel, Inhuman and Degrading Treatment or Punishment. And he will discuss how to ensure the prohibition of torture and ill treatment in times of emergencies, and as well as give an insight to his recommendations to the states. Niels, you have the floor.
Thank you, Barbara, and thank you to the organizers. Can you just give me a thumbs up? Can you hear me? Can you hear me well? Okay, very good. So yeah, well, thank you very much for organizing this event together with us, because I think the world has really been marked by the crisis and the various unexpected also consequences of what was essentially a pandemic crisis. But it has led to all these follow-on effects that have escalated the risks of torture and ill treatment in various contexts. And so I know that we have many speakers that can speak from the ground and from their various perspectives. So I'd like to just acknowledge that, yes, of course, restricting human rights in times of emergency can be legitimate. It can even be necessary to protect the public interests of the inhabitants of the various countries. And so these measures are not necessarily unlawful, but they include a significant risks of overshooting and also of abuse. And so therefore it is important to recall the principles that govern any restrictions of human rights, also in times of emergency, and especially obviously any measures that involve the use of force. And so I think it's just important to recall that any restriction of human rights requires a lawful basis, a lawful purpose, and needs to be necessary for that purpose, and which means that you cannot achieve that purpose with less harmful means, only then it can be called necessary. And also that we always have to balance the purpose we're trying to achieve and the harm we're inevitably going to cause in terms of restrictions of human rights in trying to achieve that goal, and always balance this out and ask ourselves, is this proportionate? So it's about necessity, it's proportionality, and obviously there needs to be an attitude of precaution throughout the process. Authorities have to be aware of the risks that go along with the measures they're taking. And this, I think, many of our panelists will speak to that in more detail with regard to the places of detention, and restrictions of visits to a place of detention may seem logical in terms of a virus spread, containing that spread, but it will also immediately cause problems when inmates obviously depend on visits for their daily needs of food and medicine and so on. Others will speak to that. But outside also the custody context, we see that curfews and lockdown measures have been imposed, and somehow so much priority has been given to the security aspect of this that it has been ignored what the grave consequences go along with locking up basically half of the world's population in their homes. Not to speak of the people and the millions that don't even have homes and that they could be locked into, or people that are being locked into very poor accommodations. In using force, I think states have to be reminded, and that's what we're working on very intensely, that no one can lose their protection against torture and other cruel, inhuman, or degrading treatment, even in times of emergency. And especially in times of emergency, we have to ensure that the use of force and other measures are not amounting to and resulting in and are not conducive to torture and other types of ill treatment. And that really requires a lot of training. It requires appropriate equipment, but then also it requires a holistic approach. You cannot just enforce a curfew when people are hungry inside their homes. You cannot just, blindly enforce a curfew when women have to deliver their babies in a hospital and have complications. So you have to be, have a holistic approach of the complexity of these types of measures, because otherwise police officers with a kind of simple-minded, too narrow focus on just enforcing curfews and lockdown will tend to use force without balancing these interests, without having the appropriate instructions on how to ensure public health, but at the same time also respect other rights that are just as important, or in specific moments may be more important, than preventing someone from leaving their house. So I think that is really extremely important. We have seen that this has been problematic in practice. From my mandate's perspective, I'm cognizant of the time. I will not go much more detail, but we have submitted communications to Colombia, China, Malaysia, Uganda, the US, and Venezuela, and Zimbabwe, and others on these topics. They will all be published on the OHCHR's communication webpage. And I will be happy, I'm over 5 minutes now already, I'll be happy to engage more with the audience on specific questions. Many thanks again for having me.
Thank you very much, Niels, again, also for respecting the time, but also to recall the basic principles that are necessary in enforcing the restrictive measures, and especially the use of force, and not put an overemphasis on the security versus the respect of the absolute prohibition of human rights. This was very important. I now have the pleasure to give the floor to Professor Nimia Simbulan from the Medical Action Group in the Philippines. And she will indicate what has been the impact for her organization and the beneficiaries of her work of the restrictive measures, and especially regarding groups in situations of vulnerability. Professor Simbulan, you have the floor.
A pleasant day to everyone. I represent the Medical Action Group. It's a human rights NGO promoting the right to health, primarily of victims of human rights violations, including persons deprived of liberty. When the COVID-19 pandemic was declared in the Philippines, the immediate measure taken by the Duterte government was to impose a community quarantine that would be considered as lockdown, and the strictest of which would be the enhanced community quarantine, together with the imposition of a curfew. The Philippine government, under the current administration, has consistently used war as a framework in addressing the country's social ills. So the global community knows about what has been referred to as the war on illegal drugs. And when the pandemic hit the country, a similar war was declared, and that would be war against COVID-19 pandemic. Like the war on drugs, the use of war as a framework in combating COVID-19 has made the Philippine government resort to the following: the treatment of a public health crisis like the pandemic as a problem of law and order, reliance on state violence, the use of threat and harassment, strict compliance with the chain of command from the commander-in-chief down, similar to a war situation. There is no room for questioning, very low tolerance for criticism and opposition. Also, law enforcement agencies and military forces have played key roles in the enforcement of rules like the enhanced community quarantine and the curfew. Now, what has been the impact of all these policies and pronouncements on the Filipino people, particularly vulnerable groups? This has resorted to cruel and inhuman treatment of individuals, mostly urban poor residents or slum dwellers, for alleged violation of quarantine and curfew rules. For instance, we have been able to document, and this has been covered by the mainstream media, of young men who have been charged of violating quarantine and curfew rules being locked up in a dog cage. You also have children for alleged violating curfew or quarantine rules being locked in a coffin. You also have men being made to squat under the heat of the sun for hours because they have been found outside their places of residence. Aside from this, we have also been able to document torture, which includes beating of curfew violators, mostly urban poor residents or slum dwellers. There is also illegal arrest and detention. Also, there is the pronouncement of what we in the human rights movement have referred to as the kill policies of the government. And this would include the order of the Philippine president to, quote unquote, shoot to kill those violating the enhanced community quarantine. There is also discrimination as demonstrated with the special treatment of top government officials violating ECQ and being given preferential treatment to testing in a situation where the country had very limited testing supplies or testing kits. And then as noticed by the global community, you have the attacks against freedom of information and expression through red tagging and labeling of critics as terrorists and enemies of the government. In addressing all of these restrictive measures, the human rights defenders in the country have taken on these challenges by embarking on several tasks. And this would include human rights information campaign under ECQs, using technology, using webinars like what we are doing now. Human rights education, that would include the conduct of online discussion via live streaming on human rights and COVID-19 related issues, the right to health, repercussions of the enhanced community quarantine on the people's rights to food, work, health, and its impact on sectors like labor, women, LGBTQI, and children. In certain circumstances, we have also undertaken online protests and petitions. Monitoring of human rights violations under the ECQ have likewise been undertaken. Lobby work in Congress, especially since it was under the current conditions where the push to pass the anti-terrorism bill have been made a priority of the Philippine government. Then NGOs have also extended various forms of assistance to vulnerable groups, particularly those affected by the prohibitions or restrictions on the freedom of movement. And finally, we have done international solidarity work to get the support and to make the conditions in Philippine society known to the international community like the United Nations. Thank you.
Thank you very much, Professor, for this very powerful testimony about what's happening in the Philippines in terms of enforcement of the restrictive measures and ill treatment and cases of torture, but also about the continuation of the human rights defenders' work in terms of help, support, advocacy, and solidarity. Thank you very much. I now have the pleasure to give the floor to Mrs. Vivian Nathanson, the chair of the UN Voluntary Fund for Victims of Torture, who will share the results of a survey conducted by the fund with the grantees and show how they have been affected by the COVID-19, especially in providing redress and rehabilitation to victims of torture, including asylum seekers. Mrs. Nathanson, you have the floor.
Thank you very much, and thank you very much to APT for organising this webinar on this important day. The fund has recently surveyed all 164 organisations who are currently receiving grants from us, and they are in 78 different countries worldwide, so that's in every region of the world, and that includes the 4 grantees who are giving testimony today. And so far, we've had 127 responses to that survey on the impact of the pandemic, on the essential services they provide to over 40,000 victims of torture. And that includes looking at whether they are seeing changes in patterns of torture, as well as the issues of how they are trying to provide services in a time when most countries are still in some form of lockdown. And although some of those are easing, that is not necessarily going to be sustainable, looking at the evidence that's emerging from the World Health Organization of a second wave already emerging in the epidemic. So that what we're finding is an increased vulnerability and a disproportionate impact on people who are already survivors of torture. So many of these people will, for example, be in refugee camps or in poor housing. They may well not be able to work or be in very poor paid work. Sorry.
Sorry, you have been muted for...
Has it been muted throughout?
No, since you were discussing about the poor housing and the...
All right, poor housing. And the importance of this issue in terms of housing is that protecting yourself from getting COVID is about being able to distance from people, being able to wash regularly and so on. If you're in a refugee camp, you're unlikely to have unique access to running water, soap and so on. So all of those things are important, but also the sheer fact of being isolated, being unable to try to form or to continue with relationships with people makes it very difficult for people who've got the psychological consequences of having been tortured. If you already have post-traumatic stress disorder, then you are likely to find that exacerbated by being locked down in a refugee camp or in a situation where there are few people for you to be able to talk to. And Claire has already raised the issue of she called it spatial apartheid, and that of course is very true for survivors of torture, particularly those who are in refugee camps, but not only those. They tend to be in the poorest parts of the population. And so what the grantees are finding is that there is an increased need, not just for medical and psychological support, but also for the basics of living. There are people who cannot afford and cannot get access to food and water and heating and shelter and so on. And there are demands and needs for those, as well as for an increased need for psychological and physical support. So we've seen a 9% increase in the need for medical assistance, a 17% increase in the need for psychological assistance. And we know that, for example, as the Special Rapporteur on the Right to Health stated this week, the virus, social isolation, economic downturn, and increased violence have all fueled mental distress, anxiety, and fear. We're seeing a 20% decrease in the budget lines to provide legal assistance, and I'm sure that that will be picked up by other speakers. We're seeing trends that other speakers already mentioned about violence from within confinement, with the police particularly under the rubric of enforcing the state of emergency, and deteriorating detention conditions as well, with the limited or non-existent hygiene measures. And I know that Jens is going to talk about conditions in detention, so I won't go into that. What our grantees have been doing is using innovative methods. Thank heavens for the internet and telecommunications and so on, because that has been a very strong feature in the provision of particularly psychosocial support, talking therapies, but actually being able to keep people in contact with somebody who understands the situation that they're going through. But we're also seeing an increase in vicarious trauma for the staff providing these treatments, because normally they would be in groups working from offices, working together, and they would be able to support one another. So worryingly, because they are also isolated, they are finding it very difficult to cope with all of this, and there is a secondary increase in traumatic stress disorders, including burnout amongst the staff. And there are also restrictions and reprisals. The lockdown is being used as an excuse for a further decrease in the social space, the space that we have as a civil society. And 15% of grantees reported retaliatory measures taken against them and their staff for trying to help torture survivors. And that is a significant increase on what we've had in the past. So what does this mean? What it means is that all of these organizations, or the majority of them, are now seeking more help. 58 of those 127 who responded have a need for an emergency grant, and that amounts to about $1 million US that we've been asked for immediately. That's a great deal more than we would normally have in the budget. And we also know that we already have a very large set of grant applications for next year's grant, and we don't have any security at the moment as to whether we will be getting funding. So it's an appeal as well to the countries that have always been helpful to us and generous and supportive, to continue to do that, and for other countries to come on board, because we need to get money out to these organizations, and particularly in the form of emergency grants. The $1 million immediately is probably going to be just a drop in the ocean compared to the actual need. But the good news is that the grantees are out there. They have found ways of working in this restricted space, and that means that we can actually help many of these survivors, even in these difficult times. Thank you.
Thank you very much, Mrs. Nassasan, and congratulations for the survey and the high level of responses. I think this was very important to have this information from the ground of what is happening and how it's affecting the grantees. And you also highlighted this issue of intersectionality of risks and the disproportionate impact of the restrictive measures on victims of torture, but also the social isolation, which is affecting us, but affecting more the victims, but also the grantees. And we also heard your call for an increase in grants to allow these emergency responses that are needed. We are now entering in the questions, and we have received a lot of questions on the Q&A. I would just like to highlight 3. I know that Nils Mester has to leave soon for important reasons, so I will give him the floor first to respond. I would also like to inform the newcomers that they can put questions on the Q&A and that they can have access to interpretation when they click on the small globe on the screen below. So the 3 questions are there is one set of questions on the alternative measures to detention and freeing of people to address overcrowding. How to ensure that those measures don't discriminate human rights defenders, political prisoners, and other groups. And also another questions, in times of COVID, how to get accurate and sufficient information from authorities about the situations of persons deprived of liberty. And finally, a question on transparency and accountability and how these can be affected by COVID-19 restrictive measures. So I will give the floor first to Niels, and then I will go reverse order to Vivian and to the others. Niels, you have the floor.
All right, thank you, Barbara. Yes, obviously, we've had extremely valuable information, and I know many of the questions that have been asked will also be addressed by other speakers. Clearly, in all the measures that are being taken, including the ones like relieving pressure on prisoners through early release and alternative measures, we have to look at abuse not happening during those measures through discriminatory choices and so on. And for this, we do need, and that links up to transparency and accountability, we need independent monitoring. And I know the Malcolm Evans certainly will be speaking about visits to places of detention, but independent monitoring and transparency, so we can actually know what the criteria are for these measures that are being taken to avoid discrimination. I think just to speak one more time a little bit to the problems with law enforcement measures, I think what we see now in this context is the consequences of decades of a tendency towards militarizing police. We can see it in the COVID, we have seen it in the US recently in the police violence protests and so on. And we have to be very vigilant and recall to states that they have to train their police to an awareness that they're serving their people. It sounds very simple, but when you consider national security, something you have to defend against the people, then the people become their enemies. And that's exactly what we're seeing, these harsh measures, use of force against the people, when actually these lockdown measures and preventive measures for the spread of the COVID should be for the people. It sounds very simple, but I think it's important that we always stick to this basis. And the second point, very briefly, is just that we have to be aware that use of force does not only become excessive when it's lethal and deadly, but as soon as it is excessive, and excessive means when it's not strictly necessary to achieve a lawful purpose, or even if necessary, the harm is disproportionate to the benefit that you would like to achieve with that measure. It also sounds very simple, but we need to train a law enforcement and to this, and also hold them accountable when they cross this line, because whenever that line is crossed, it is not just bad policy, it actually does amount to cruel, inhuman, or degrading treatment, and if the person is powerless, it even amounts to torture. I'd like to close here and thank you very much for this, and I trust that many of these important issues will be addressed in the further discussion. Thank you very much.
Thank you very much, Niels, and indeed, I guess the discussion will continue also in the implementation of your mandate. I now give the floor to the reverse order, so I give the floor back to Mrs. Nathanson.
Thank you. I thought there was a very interesting comments from Niels, and I'd just particularly like to pick up this issue of early release, because one of the issues we have to recognise is that releasing people from prison and detention is a good thing, except if you don't have anywhere to go to. So one of the things is that within all of this, we have to recognise that this is a human crisis as well, and that it's a humanitarian crisis when we deal with COVID. And we must make sure that people are given places of safety to go to. And if that means that the government for a short period will have to provide alternative accommodation of a reasonable standard, and a reasonable standard means privacy, safety, the ability to keep yourself hygienic, the hygiene issues, all of those things. And that is something which we're seeing is not necessarily being done. People are being dumped out of prison without necessarily the wherewithal to get to wherever they might be able to access shelter, food, and so on. And there is a big issue here about training, absolutely. Governments have written new legislation. They're using new powers. Those powers have often been written into legislation for the first time. And it does seem that not all of those have actually connected well with human rights requirements, or indeed with the normal rule of law and accountability and so on. And we do need to make sure that the police are properly trained, that there are limits to what they should do. We've had a very restrictive lockdown system in the UK, which is now relaxed. But one of the things is that the police forces that would stop people who were driving unnecessarily and say politely to them, you really shouldn't be doing this because, have come in for praise. And I think that that is good. So they've understood it. But most police officers are saying, we didn't know what we were supposed to do, how we were supposed to handle this. So we need to recognise that in countries where the police normally see part of their role as restricting people, as enforcement in a heavy-handed sense, this is going to be used as a heavy-handed opportunity for further enforcement. And I think that that's something that we need to recognise. And that is about accountability. At the end of this, we must have proper accountability in public to answer to what governments did.
Thank you very much. I give the floor now to Professor Simbulan for some words. 2 minutes, please.
In the case of the Philippines, when the COVID pandemic struck the country, one of the immediate measures was the call of the Philippine Supreme Court to release at least 10,000 PDLs, or persons deprived of liberty. But this call was based on certain criteria, and that would include release of PDLs based who are elderly, sick, who have served their minimum sentence, and corollary to that would be what has been referred to by Ms. Nathanson, and that is providing the necessary support mechanism. That it's not only allowing them, it's not only releasing them, but also extending the necessary support, and that would include testing before they go back to their families or to their relatives, providing transportation for them to go back to their provinces or to their relatives. Unfortunately, despite this call of the Philippine Supreme Court, based on the recent monitoring done by the Medical Action Group, it seems that that has not been implemented. as far as we know, only a small number of PDLs were released. A substantial number of the 10,000 ordered by the Supreme Court has not yet been released because it's taking the government some time to process the documents. While the documents are being processed, they continue to stay in jails and in the state penitentiary, which based on statistics, you would consider Philippine jails and prisons as one of the most congested places in the country.
Thank you very much. I think this leads as well to nicely to the second session. But before, and last but not least, the pleasure to give the floor to Claire Ballard for final responses to the questions.
Thank you. To pick up on the idea of professional policing that was mentioned just now, the empirical evidence and information is widely available, and yet those that are tasked or would be tasked with overseeing the transformation are not held accountable. And it's easy for them, the government, to remain complacent about these ideas, because in a country with such a high crime rate, there isn't a public demanding that the rights of detained, the rights of offenders be given any form of precedence. And so it's easy to kind of let that one slide under the radar. So there's a lack of, a transformation in respect of the professionalization of policing, but also the professionalization of oversight mechanisms. And we see that reflected in their lack of independence, the lack of the requisite budget for being able to carry out crucial tasks of inspections, of complaints processing, and so on. Similarly, when we look at government's response to COVID in respect of prisons and the establishment of a parole release program, we see an enormous public outcry, which is largely based on misinformation. For the most part, parolees that have served a certain amount of time in prison anyway are not likely to reoffend. If anything, parolees, incidences of reoffending in respect of older parolees are largely exaggerated. Again, politicians could use that opportunity to educate the public about what we know empirically about this population group, and yet they don't, because it's high crime rate, large scale fear and insecurity, and this leads to a lot of inaction for fear of being seen as soft on crime. And yet every single time this goes counter to what we know scientifically about criminal justice and the reasons why crimes are committed and the environments that are criminogenic by nature. And I think we miss out valuable opportunities, again, during the COVID-19 response.
Thank you very much to the four distinguished panelists for this first session. I think it has highlighted a lot of very interesting issues, and especially this emphasis of the authorities on the security rather than on the safety of all, whatever social safety and health safety. And I think this was a main issue. We have also started to enter in the second discussion on the issue of detention and deprivation of liberty, but this is very fine, so because in a way we have an holistic approach as well. So we are now starting the second session, I think right on time, which is looking at the specific risks of torture and ill treatment faced by persons deprived of liberty due to the COVID pandemic. And we have the pleasure of having four distinguished speakers. We will hear from Mara Carneiro from Brazil, Malcolm Evans, the chair of the subcommittee on prevention of torture, Yusra Al-Karlaini from Jordan, and Jens Modvik, the chair of the committee against torture. I think I'll start immediately with Mrs. Mara Carneiro, who is from the Centro de Defensa de Criança y dos Adolescentes de Ceará, Brazil. So please, participants, Mara will speak in Spanish. So if you want to listen to her intervention, you go on the small globe on your screen and press off and switch to the channel French or English. Mara tiene la palabra.
Hola, buenos días desde Brasil. Me gustaría agradecerles la invitación a compartir cómo hemos realizado nuestro trabajo en tiempos tan desafiadores. La situación de privación de libertad en Brasil es grave. Tenemos la tercera población carcelaria adulta del mundo. Adicional a isso, teníamos antes de la pandemia a cerca de 30.000 adolescentes privados de liberdade. De modo general, la privación de libertad en Brasil es marcada por hacinamiento, condiciones insalubres, falta de apoyo de proyectos que resignifican la vida de los prisioneros. Es marcada también por la violencia, sendo la tortura física y psicológica una práctica común e infelizmente aceptada socialmente. Aceptada también por parte significativa de los agentes estatales, incluindo hoy a las más altas autoridades brasileiras. O presidente defiende abertamente a tortura e seu governo ha fragilizado o sistema de prevenção, inclusive com inumeráveis tentativas de inviabilizar o trabalho do Mecanismo Nacional de Prevenção e Combate à Tortura. Isso ha tornado a assistência às vítimas mais difícil e complexa, sobretudo agora em contexto da pandemia de Covid-19. A pandemia revelou a profundidade da miséria de nossa desigualdade social e demonstrou o fracasso das políticas de encarcelamento. Enquanto ricos e blancos permanecem aislados socialmente em el conforto de seus lares, negros e pobres se amontonam em las cárceles brasileiros, sem contato direto com suas famílias, com menor aparato de justiça para a defesa de seus direitos, com a diminuição das visitas de inspeção e com pouquíssimas condições de se defender da infecção. E há que falta tudo: higiene, tapa-bocas, álcool em gel, equipos de proteção, pruebas, etc. Em Ceará, estado onde se localiza a SEDECA, ela em último levantamento de dados sobre Covid em los centros apontam que por lo menos 22 adolescentes ya deram positivo, pero há por lo menos outros 89 casos sospechosos. Quanto a los profissionais do sistema, 163 já foram confirmados e 574 estão em suspeita de Covid. Inclusive, um diretor de uma unidade morreu. Lo que apresenta um quadro de risco para os adolescentes, já que as unidades de detenção juvenil não contam com os devidos insumos e protocolos adequados para garantizar que a enfermidade de los profissionais não chegue a los adolescentes. Em este sentido, el SEDECA ha actuado em duas frentes estratégicas. Impacto e seguimento da política para garantizar a proteção de los adolescentes privados de liberdade. Hemos monitoreado a situação através de associações com órgãos públicos e participação da SEDECA em los conselhos, comitês e grupos responsáveis para dar respostas à crise de Covid. 2. Assistência direta à vítima de tortura. Para isso, contamos hoje com o importante e fundamental apoio do Fundo Voluntário das Nações Unidas para Vítimas de Tortura. O SEDECA, em este momento, tem 37 casos de tortura em acompanhamento. As vítimas han colocado que a pandemia los ha dejado mais expostos à violência e à tortura, sobretudo por a ausência de visitas por parte de suas madres, suas famílias, por a diminuição drástica das visitas de inspeção de órgãos externos e de controle social. O contato com as famílias hoje sucede por telefone y sin privacidad. El SEDEC ha defendido en los comités de crise que sea hecha videollamadas, assim como que los familiares consigam minimamente mirar para los adolescentes e detectar alguma violação. Pero também reconhece o limite dessa proposta, já que muitas das sequelas de tortura não são possíveis de visualizar deste modo. Sobre nossa assistência direta, hemos oferecido às vítimas que nos ligam apoio humanitário com canastas básicas de alimentos, produtos de higiene para quem manifesta situação social e econômica muito precária. Apoio em saúde e provas para casos suspeitosos de Covid. Temos oferecido também assistência jurídica, assistência social e assistência psicológica remota individual e também atividades grupais remotas para atenção de saúde mental. O período é de extrema dificuldade e nos desafia a pensar em novas formas e estratégias de continuar com a assistência às vítimas durante essa tragédia sanitária. Necessitamos lutar contra a invisibilidade de la tortura em nosso país e em el mundo. Só assim poderemos falar de uma sociedade verdadeiramente democrática. Muitas gracias.
Obrigada. I will now switch back to English. Thank you very much for your testimony about the situation in the prisons in Brazil, characterized by overcrowding and violence, but also about the work you are conducting with the juveniles in helping and assisting juveniles in places of detention and ensuring that victims receive assistance in to fight against what you call the invisibility of torture. I now have the pleasure to give the floor to Sir Malcolm Evans, the chair of the UN Subcommittee on Prevention of Torture, who will share the specific challenges related to monitoring in times of COVID and considering the lockdowns and specific measures, as well as share the findings from the survey conducting with the national preventive mechanisms and the states. Malcolm, you have the floor.
Thank you very much. Can I just confirm that everyone can hear me? Perfect. Well, there's a lot of ground to cover in a remarkably short period of time, so I will try to be as focused and concise as I possibly can. I've been asked to comment on two specific questions. The first, interrelated, of course. When the nature of the COVID pandemic became clear to us and its effect on preventive visiting as organised under the OPCAT system became clear, the first thing that we did was to issue an advice to national preventive mechanisms, setting out what we thought they should take into account when trying to carry on with their mandates during that time. We then wrote out to all 90 states parties to the optional protocol and to approximately 80 plus organizations operating as national preventive mechanisms within its framework, asking them for details of what their experiences and responses had been. The first thing that it is worth saying is that the response to those requests was really outstandingly positive. Within a very short period of time, we got responses from over 50 of our states and over 75 of the national mechanisms that we approached. And that was the basis for much of what I'm going to go on to say in terms of our experience, both in the challenges that they have been facing, but also in some of the things we need to think about as recommendations for moving forward. Of course, from an SPT point of view, one of the very first things was the inability for us to conduct our own visiting mandate, as international travel became all but impossible in these circumstances. And so, of course, in the light of that, we refocused on what could be done by those partners on the ground in country, the national preventive mechanisms. And what we found from liaising with them in a nutshell was this. First of all, it has shed new light on the question of what counts as a place of deprivation of liberty. Some of the earliest questions that we were asked, and still seem to be asked, are places of quarantine places of deprivation of liberty? We have answered this very clearly, that a place of formal quarantine most certainly is a place of detention, for it is a place that persons are not free to leave. And that is the rather simplistic but powerful way in which we approach the mandate in terms of what counts as a place of detention. But beyond that, and time does not permit, there are all sorts of further questions that flow on from that concerning private places, lockdowns, etc., etc. At what point do these generalized state-imposed restrictions convert what would otherwise not be a place of detention into what is de facto a place of detention, and therefore within the remit of preventive visiting as provided for in the OPCAT? That is a question on which NPMs and we are going to have to ponder in the period going forwards. What we have certainly found is that even where it has been accepted that places of quarantine fall within the mandate of national preventive mechanisms, in theory, the practicality of the way in which their own mandates have been drafted may mean that they do not actually have the mandate to do so. So even if it is accepted that they should be visited, particularly when it is built of a gathered set of inspectorates based on criminal justice facilities or care home facilities, for example, quarantine places which fall outside of those brackets may not fall within their scope. And that is something that also needs to be dealt with. Another problem that many NPMs have faced practically to do with preventive visiting is, well, even if they are able to visit such places, and indeed other places of detention, have they been designated as key workers, for example, in many countries, so as to be able to leave their own properties or to get the necessary travel permissions in countries that required these in order to actually undertake the elements of the mandate that they were empowered to do. And so we have examples of some NPMs wishing to travel and being denied permission to either leave their homes or be given the papers necessary to allow them to transit across cities or regions to be able to do their jobs. And again, this was another learning point. A further challenge that has to be faced, of course, is what is going on within the places of detention themselves. Naturally, many restrictions, as other speakers have indicated, have been placed on internal life within places of detention, and it is entirely appropriate that that external visitors respect necessary health measures in order to spread the virus and to secure the health environment of the place of detention. The do no harm principle is very important within this context. But at the same time, it remains necessary to be able to monitor the restrictions which have been put in place, both for their legitimacy, but also for the manner in which they are being applied and the practical effects that they may be having on persons in places of detention. And how is this to be done? In some countries, direct access has still been made possible, either directly on a person-to-person basis, but with a form of distancing, or through electronic contact. The use of PPE equipment has given rise to controversy in some countries, either in terms of its being made available to NPM or detention visitors, were they seen as necessary recipients of it, but also for the effect that its wearing may have on those with whom they're engaging in places of detention, about whether this is deemed to be appropriate, etc., etc. And above all, in the short time, I just wish to flag the questions of what are the standards which are to be implied in pandemic situations, and for how long can they continue. This is something of a lacuna. It is understood that restrictions may be brought in times of emergency, but what quite the parameters of restriction in emergency periods are upon basic elements of regime in places of detention remains underexplored, and is something that needs to be done for the future. Above all, maintaining effective contact with the outside world, not just for prison oversight and inspection, but for families and others, as other people have mentioned, who are often a lifeline in more ways than one for detainees in places of detention. So as we bring this to a close, recommendations, clarifications of NP.
I'm sorry,
yeah, closer working liaison with authorities, and the most important point on which I will finish, as restrictions are being lifted, to make sure that those in detention are not left behind. Restrictions were very quick to be imposed on such places. Our fear is they will be among the last to be lifted, and that would be wrong. Thank you.
Thank you very much, Malcolm. I'm sorry to
absolutely fine.
Yes, no, I think this survey was very important, as you say, because to have the contact with the national preventive mechanisms and the states, and you had a high rate of responses, and the questions about the definition of places, but also the problems of visits, access to places, and how to visit. And your last point about now that we move in a different phase, make sure that this is not leaving people behind, especially persons in places of detention. I now move to Mrs. Yusra Al-Kailani from the Center for Victims of Torture from Jordan, who will share with us the challenges faced in providing rehabilitation and essential services to torture survivors, and especially in migration setting, and in what way the victims of torture have been particularly vulnerable to COVID in these places. Mrs. Al-Kailani, you have the floor.
Thank you, Barbara. Thanks for the organizers, the panelists, and for the speakers for their testimonies. Actually, today is a very special day for the Center for Victims of Torture. Every year, we are celebrating our achievements in supporting the victims of torture and honor the significant resilience we have witnessed and survivors of torture. This year is very exceptional due to the COVID-19, and this made our mission and our partners also even more important. The current crisis has impacted all of us globally in many ways. Survivors of torture and gross human rights violations have been greatly and uniquely affected by the pandemic. For many, the experience of quarantine and isolation has triggered memories of traumatic experience in their past. The increased presence of security forces, restricted movement, uncertainty and fear, difficulty in accessing basic goods like food, and being separated from family and loved ones has led to an increase in trauma-related symptoms such as anxiety, fatigue, sleep problems, and various physical symptoms. We have seen the effects on both mental and physical among survivors, many of whom are already struggling with past trauma and continued stress. COVID-19 has compounded this. Through our work of our Survivors of Torture initiative, which was also SOTI, that focuses on strengthening civil society organizations, advancing justice efforts, and trauma healing, we have observed the effects of quarantine in human rights defenders who have experienced detention and siege inside Syria. In response, we developed a self-help booklet, which we shared with these individuals to learn about these experiences in line with offering tips and skills to manage trauma triggers. We also continue the provision of self-care and self-care support for civil society organizations, as well as providing online and remote training for clinical teams. CVT clinical programs in Ethiopia, Kenya, and Uganda, which work both in community and camp settings, have faced many challenges in providing in-person rehabilitation services, including mental health, physiotherapy, and social services during the pandemic. As a result, our services switches to use of emergency phone line to respond to clients with ongoing supervision and mentorship by our side. These interventions contribute to help beneficiaries to cope with anxiety and stress during the quarantine. However, one of the most challenges we faced was client accessibility to phones and finding ethical ways for consent when clients had to use a phone from a neighbor or a family member. We have also been facing many challenges with cases who have experiences in domestic violence, gender-based violence, and also high-risk clients who have suicidality and self-harm. And also like finding ways of supporting these individuals. This has created a great need for innovative but low-tech telemental health and physiotherapy approaches. The fear of COVID-19 hitting refugee camps has been a particular concern to CBT. In this context, social distancing is almost impossible and health facilities are often limited. Communication is also a challenge, and CVT has had to find creative ways to provide key information to beneficiaries. As for example, in Ethiopia, counselors have been broadcasting pre-recorded messages via megaphone while riding around on bicycles. The CVT's Jordan program, which was an urban setting, lockdown occurred rapidly, creating uncertainty and anxiety among both our staff and beneficiaries. In addition, the lockdown started in the middle of the healing group 10-week cycle, when survivors normally have the opportunity of sharing their most difficult moments. Difficult decisions had to be made to suspend the cycle in order to reduce harm. Since then, CVT interdisciplinary model have been providing ongoing follow-ups and check-ins for beneficiaries. Even social workers have been connecting with clients to help meet their urgent needs and address protection issues when necessary. One of the greatest challenges in the community, however, was the basic services were extremely limited or unavailable. This has increased the vulnerability of beneficiaries and left CVT staff often struggling with feelings of helplessness. CVT is determined to promote self-care and well-being among staff and partners. And we are really focused at this stage to deliver training, supervision, and for our staff and partners on self-care and how we can balance and cope during this difficult time. As restrictions begin to be lifted in some of the CVT locations where CVT works, we are aware of how much we have learned through this time, both about our own resilience and that of our beneficiaries. Despite the huge challenges faced, we are encouraged by feedback we receive from beneficiaries, such as a person who said, CVT was the only link for me to the outer world. Thank you.
Thank you very much for this important testimony and for the important work you are conducting in a difficult situation in Jordan and raising the challenges that you have mentioned in terms of trauma, past and current that is adding, but also the issue of self-care and this important keyword that you used in the end about resilience and the importance of being resilient. Last but not least of our distinguished speakers is Jens Modvig, the chair of the UN Committee Against Torture, who will elaborate on the health measures that are needed to prevent the spread of the COVID in places of detention and their impact on detainees. Jens, you have the floor.
Thank you very much, Barbara, and thank you for inviting me to speak. When we consider the health measures in places of detention, and this could be prisons or even migration detention centers, and we do it together with the UNCTAD's obligation to prevent torture and ill-treatment, I believe there are three important aspects. Firstly, protecting detainees against infections, and we would ask, are the authorities effectively protecting inmates against spread of COVID-19? The second one would be providing equivalence of healthcare. And we would ask if the authorities, if the principle of equivalence of healthcare is respected, that is, we have the same quality and access to healthcare inside places of detention and outside. And the third question would be, respecting human rights. Are the authorities in their management of the pandemic respecting the dignity and human rights of detainees when implementing the measures to cope with COVID-19? And I will elaborate these three issues, starting with protecting detainees against infection. As we know, prisons and pretrial detentions and other centers like this are incubators of infectious diseases. This means that when measures taken are insufficient detainees run a very high risk of catching COVID-19. In some prisons, the prevalence of COVID-19 among prisoners is 80%. Such situations make it very difficult to avoid that prisoners, on top of their sentence, get a serious, potentially fatal disease as a second punishment. Obviously, overcrowding, which prevails in so many countries of the world, are contributing to the possibilities or the lack of possibilities of controlling the pandemic. And here, of course, state parties measures to reduce the prison population, both in intake and release, are very important. An effective way to prevent detainees from spreading the pandemic is to undertake a thorough initial medical assessment, including a COVID-19 test, and then isolate positive cases and quarantine suspected cases. Since the incubation time is between 2 and 12 days, but with a maximum around 4 to 5 to 6 days, the time may touch upon the upper limit of solitary confinement according to the Mandela rules, namely 15 days. So it's important to ensure that isolation and quarantine are not exceedingly used, and to ensure the psychological well-being of detainees when isolated. Of course, it's also relevant to ensure that staff in these places of detention are trained and have the appropriate instructions. These instructions could be, and training could be, in the general preventive measures, but particularly it could be in how to use force and still protect themselves and others against spread of the disease. When you use force, you're often in very close contact with the detainees, and maybe you don't know if the person is COVID-19 positive. A particular problem is the vulnerable groups with medical conditions that put them at high risk of a complicated or fatal course in case of infection. Authorities need to identify vulnerable groups and to provide a safe solution, including special accommodation and procedures to protect these groups against risk of COVID-19 and, by the end of the day, a fatal course. Moving to the second one on equivalent healthcare, apart from what is already said about the importance of the initial medical assessment, access to health facilities in places of detention has to match those outside. This applies to access to testing for COVID-19 and also to treatment for COVID-19 in cases of positive test. In particular, it's important that the health service in places of detention are able to test all newly arrived detainees and all with symptoms of COVID-19. If not, the risk of including positive cases into the general prison population is very high. In case treatment facilities, including the possibility to refer detainees to hospital treatment, including to ventilator treatment, are insufficient, there's a risk of detainees dying from COVID-19 under inhuman conditions, being suffocated from the inability to breathe. Another aspect of the equivalence of care is the access to personal protection equipment, PPE, which applies both to detainees, including vulnerable groups, allowing these groups to protect themselves, and to staff, which moves in and out of the prison and makes up a risk to the detainees. Lastly, as had been already addressed in the other panel, it's important to have procedures in place for released prisoners and detainees. Are they tested? How are the regimes continued after release? And what would be the impact on public health? And moving to the last topic, respecting human rights, much of this discussion obviously addresses the respect of human rights under the pandemic. More specifically, conditions of isolation and quarantine, which has to be carried out for up to 2 weeks, run the risk of inducing in treatment or even torture. So it's important to ensure meaningful activities and contact during the isolation or quarantine. Rough procedures of isolation and quarantine, maybe on dubious foundations, may easily be considered violations of human rights and may amount to ill treatment. Hence, there needs to be objective criteria implemented by health professionals for use of isolation and quarantine. While the CAT is currently unable to exercise the core parts of our mandate, we will certainly address how the authorities have addressed the pandemic. And we will address issues like testing and examination on arrival, procedures for isolation and screening, identification of vulnerable groups, special accommodation for vulnerable groups, and release procedures. And such issues will be considered for our reviews of state parties in the convention. Thank you very much.
Thank you very much, Jens, for highlighting this from the medical perspective, and especially the three important aspects that you mentioned in terms of protection against infections and the equivalence of healthcare and the risks in terms of human rights, especially with isolation and contacts. We are coming to a close of the first session, but we still have the questions. And would it be possible to extend for 10 more minutes than planned, so 40 to 3? If so, we will move to the questions, and we have chosen three questions from the different questions posed on the Q&A, and thank you to all who have put questions. The first one, which is a link more to the previous session, is a question on the misuse of counter-terrorism measures and legislation to enforce curfew and quarantines. If you can answer this misuse. The second question is, there has been a lot of opposition to decongestions or decarceration measures due to risks of family and domestic violence. What would be your recommendations or from your perspectives? And last question from IRCT is, how effective is it to apply pressure on decision makers through letters of concerns from civil society organizations? Are there other advocacy techniques that would be more effective at this special time? And as Malcolm would have to leave as well, I propose that he starts with the questions. Jens, you will have to leave too. So can I give first to Malcolm and then to Jens? First to Jens? The idea was to go reverse order, so Jens and then Malcolm. Jens, you have the floor.
I have no comments to the first question. The second one, yes, of course, the decarceration or reduction of the population of prisons should be done very carefully, and it should be done so that you don't jeopardize neither the safety through spread of COVID, nor the security through the release of prisoners that are seriously dangerous. So, of course, it is a problem. On the other hand, if we move to the second issue, how effective advocacy, ACLU, the big American civil liberties union, have calculated that if you reduced the number of arrests to around 5% of what they are, the impact of population death because of lack of flow through prisons would mean that 100,000 people less in the general population would die. I mean, these are, so calculating what is in fact the impact on public health, I think could yield some very, very powerful, convincing arguments. Thank you very much.
Thank you very much for this very concrete advice and recommendations. Malcolm, you have the floor.
Yes, thank you. And maybe if I can just build on what Jens was saying for a moment, if we took the public health implications of the way in which we run our detention systems more generally as seriously as we have taken aspects of the COVID-19 pandemic, we would have a very different landscape as regards detention detention practice. And that's something that I think we probably ought to take to reflect on. And in a sense, that also is the point I would make about the prisoner release schemes. Absolutely, they must not be a means of just transferring a problem elsewhere, because that's simplistic and doesn't solve. It just magnifies rather than addresses problems. Of course, the root problem here is that why did you have to have such widespread release systems? Because the detention systems in so many countries are just so chronically overcrowded as to make it impossible for them to be able to cope with a situation of this nature. And if one returns to first principles and actually had a prison estate that was properly configured and was not overcrowded, then you wouldn't be having to face some of these difficulties that we have now. In other words, one of the things that we can take away from the current crisis is the need perhaps to rethink the use that is made of the penal estate. We have seen that states can do things very quickly to release prisoners that previously they said absolutely had to be in detention. We need some rethinking. On the first question, misuse of counter-terrorism and other pieces of legislation, it is certainly, I would say there are two dimensions to this. There are certainly too many instances in which emergency powers, the closest emergency powers that seem available, have been used to legitimate activities within countries which still need to be based on a rule of law system. If police are going to act, they need to have the appropriate powers to act. And using inappropriate powers, inappropriate regulation and guidance to tackle the coronavirus questions of quarantine and the like is, of course, something that needs to be looked at. The other side of that, of course, is that we know very well, and instances, of course, alleged instances have been flagged on the chat and elsewhere, that the opportunity has been used with prisoner release and other schemes to clamp down on certain groups within countries, and indeed releasing certain cohorts of prisoners who otherwise would not have been subject to release. In other words, advantage has been taken of these opportunities in an inappropriate way. And that is something which, again, is a matter of great concern to us, and we need to think about moving forward. So thank you very much. I must now leave the meeting. Thank you.
Thank you very much, Malcolm, for this very important answer. Let me now give the floor to Yusra. Please, you have the floor.
Yeah, thank you, Barbara. I would like to comment on the question about our recommendation regarding how we can support individuals who are facing domestic violence. So our recommendation is for the programming to also engage the community and to have allies from the community that they can also be aware of these cases, and also they can connect and link with organizations. Coordination among actors and organizations working in each country, in each location. This is very important, would also support referrals and access to protection. Accessibility of technology, as most of the direct services are switching to hotlines and also like telemental health. So we need also to support this for beneficiaries in different locations. And the final thing, I would say, advocacy among organizations about like how sometimes like restrictions need to be given for special cases and how need to take into consideration such emergency situations, and like authorities and facilities needs to be ready for that. And awareness raising also among communities, and keep sharing information about services available and how they can approach it. Thank you.
Thank you very much, Yusra. I now give the floor, and we will switch back to Spanish, so please be careful with interpretation. I give the floor to Mara for some comments to the questions. Mara, tiene la palabra.
Pronto, graças. Alguns perguntam se as cárceles são obsoletas. Necessitamos perguntar A quem serve o cárcere? La prisión não ha logrado reducir la violência. E em tempos de pandemia, complicam a situação de saúde. Outra observação, devemos ter em conta que a tortura também é um delito de oportunidade. Se diminuímos a presença em la privação de liberdade, favorecemos a tortura. Assim como estamos mais distante de las vítimas e hacemos que seja mais distante ajudá-las. Em este sentido, trabalhar com famílias é fundamental, porque incluso com todos, porque mesmo com todos os limites, assim como podemos chegar às vítimas que estão encarceradas. Em SEDECA temos um número de telefone disponível para receber casos de violações de direitos e torturas durante o período da pandemia. É através desse número que podemos organizar nossa assistência e guiar as vítimas e suas famílias a los serviços que oferecemos. Tendríamos muito que compartilhar, sin embargo, não temos tanto tempo. Gracias novamente por la oportunidade de compartilhar e escuchar outras experiências. Muitas gracias.
Obrigada. Thank you very much to all the distinguished panelists, but also to all the participants. We are reading a very worrying and sad testimonies on the Q&A about the impact of COVID on the detainees in a number of countries, and we are really sorry that because of lack of time, we're not able to take all the questions, but we will make sure that we will share them with the panelists and with the 4 mandate holders. I also want to remind you that the webinar is being recorded, and we will share the link with all of you and with all the participants. I think the discussion was very rich, a lot of interesting and key issues, and very strong and sad testimonies were coming from the different countries and from the civil society organization, but also the commitment from the mandate holder was key. And I think in a way, this has probably been said already, that the pandemic is exacerbating or magnifying structural issues that already exist within the institutions, be they the penitentiary system, and we spoke a lot about the overcrowding, but also the violence and the lack to health, proper health services. But the same about the police and the fact that they had new offenses, new legislation, and new powers were led to misuses and abuses. I think the COVID-19 also impacted or revealed or magnified the inequalities in societies and were really affecting the most vulnerable. We spoke about the persons deprived of liberty in the different settings, including in refugee camps and in others. But also this issue about the intersectionality of the vulnerabilities is really key and was mentioned. It also revealed the key role of the civil society in maintaining the links and the support and the assistance to the victims of torture and to the persons deprived of liberty, but also continuing their key role in terms of advocacy. And we heard good recommendations and creative ways of continuing the difficult work in this difficult situation. So the work of human rights defenders is really key. But the monitoring and the transparency of monitoring of this situation is essential to make sure that these restrictive measures are not being abused, and that the security is not taking over the safety. I think we have to continue with the key principles that are forging our work in terms of defending human rights, which is really about dignity, transparency, equality, and non-discrimination, and redress for victims. We are now entering a very difficult phase worldwide. Some countries are still in a very strong lockdown, some are phasing out, in some they are facing a second wave. I think we have to remain very vigilant over the time to come, also in the easing out of the restrictions, to make sure that situations of emergency are never used to justify violence, discrimination, arbitrariness, or torture. We have to monitor how the state is implementing these measures to ensure protection for all, and make sure that it's never ending with never amounting to torture. In this day, International Day in support of victims of torture, we have to make sure that they remain protected and that all the measures are taken to protect them in the future. Thank you very much to all. I would like to thank our interpreters for their amazing job, Nathalie Stitzel, Katia Renath, Sofia Varela, and Marta Lumbreras. I would also thank the OHCHR team who coordinated this webinar, and in particular, Kota Alir, Liliana Diaz-Trillo, Anders Malvers, Yasmin Ajuj, and Ishani Shukla. And also in the APT team, my colleagues Alexi and Audrey, who have done an amazing job. Before I leave, I also would like to continue, to invite you to continue our reflections and listening to APT podcast Perspectives, which features interviews with the UN Special Rapporteur on racism, as well as the Executive Director of the Center for Constitutional Rights. This is accessible on our website together with other tools on the issue of COVID and detention. Last but not least, I would like to give a special thank you to all our 8 speakers who have done an amazing job in sharing their perspective and their testimonies, and also in keeping the time. And I think it was a very, very rich and fruitful webinar. Thank you to everybody. Merci, muchas gracias. Goodbye.